So I know it's been a while since I've made a video. And excuse the hot messes. I've just got done cleaning the house. It's Monday, so I'm like trying to get everything done because I have to work a full week this week, which is Tuesday through Saturday. So I'm trying to get everything done around here before I have to go back to work. So I'm kind of like a hot mess right now. But I wanted to do a video about one of the conditions that I was diagnosed with, which is RA. Which is otherwise known as rheumatoid arthritis. A lot of people think that arthritis is just stiffness in your joints. And that's not the case with rheumatoid arthritis. Rheumatoid arthritis is something totally different than just orthopedic arthritis or whatnot. So I figured I would make a video telling you some of the stuff about it. This is going to be kind of long. So I might break this down into a couple parts. I'm not sure yet, depends on how long this takes. So, what is rheumatoid arthritis? Rheumatoid arthritis is a chronic inflammatory disorder that typically affects the small joints in your hands and feet. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints and causing painful swelling that can eventually result in bone erosion and joint deformity. This meaning, it's, I kind of already have it. My thumb's twisted. I don't know if you guys can really see that, but this hand is already starting to deform compared to the other hand. I have to force this hand to straighten it, and this one's already straight. I'll add some pictures in here of what it means, like when it says deformities. And an autoimmune disorder, rheumatoid arthritis, occurs when your immune system mistakenly attacks your own body's tissues. In addition to causing joint problems, rheumatoid arthritis sometimes can affect the other organs of the body, such as skin, eyes, lungs, and blood vessels. Although rheumatoid arthritis can occur at any age, it usually begins after the age of 40. The disorder is more common in women. Treatment focuses on controlling symptoms and preventing joint damage. And this says that it's normally, you can get it at any age, but you normally get it after 40. I am one of the rare cases that got it, well, one of the, I got it a little early. I was diagnosed with it last year when I was 29. I am now 30. But I've probably had it for quite some time because it'd been a while since I'd been tested for anything of the sorts. But I would say this past year was when my health started really deteriorating, to which I went to the doctor to get checked because it was getting ridiculous. But yeah, I was 29 when I was officially diagnosed with rheumatoid. Okay, so symptoms. Signs and symptoms of rheumatoid arthritis may include tender, warm, swollen joints, which would be any joints. They would be sore to the touch, and they're going to be like this pink color, as you can see, and they're going to be swollen or really warm to the touch compared to the other hand. They're warm. It's warmer. Morning stiffness that may last up to 4 hours. Now, osteoarthritis usually you get morning stiffness, but it'll wear off within like an hour. With rheumatoid arthritis, it can take up to several hours, if not go away at all, or it could take all day for it to go away. Firm bumps of tissue under the skin on your arms. Rheumatoid nodules. I actually have a rheumatoid nodule right there. You can see that. Fatigue, fever, weight loss. Actually, yeah, last year when I was diagnosed with it, I had dropped over 30 pounds in a course of 2 months, I want to say. I think it was 2 months when I dropped all that weight. I'm constantly tired. Early rheumatoid arthritis tends to affect your smaller joints first, particularly the joints that attach your fingers to your hands, which would be your knuckles right here, and your toes to your feet. So that would be your knuckles on your foot, which I do have it there too. It's starting there. It's painful. As the disease progresses, symptoms often spread into the wrists, the knees, the ankles, the elbows, the hips, the shoulders, and in most cases occur in some joints on both sides of your body, and the same joints on both sides of your body. This hand is worse than this hand. I do have them on both sides of my body, but one side's worse than the other because I use the one side more. Now the feet, it's the same. The knees, it's the same. My shoulders is the same, but it's just this hand is worse because I use it more. So I am kind of damaging the joints more so on this hand because I use it more, if you understand that. Rheumatoid arthritis signs and symptoms may vary in severity and even come and go. Periods of increased disease activity called flare-ups alternate with periods of relative remission when the swelling and pain fade or disappear over time. Rheumatoid arthritis can cause joints to deform and shift out of place. And I will put pictures. It's kind of hard to show you guys mine, but I will try to put pictures of what it can cause in there. But my thumb is twisting, my fingers are twisting. This finger right here is going underneath this finger, so okay, when to see a doctor. Make an appointment with your doctor if you have persistent discomfort and swelling in your joints. So if you're really, really uncomfortable. Now, the only reason why I went to the doctor was actually because I have also lupus, so I wanted to get my lupus checked, and when they ran the blood test, they had found out that I had RA. Causes. Rheumatoid arthritis occurs when your immune system attacks the synovium, the lining of the membranes that surround your joints. The resulting inflammation thickens the synovium, which can eventually destroy the cartilage and bone within the joint. The tendons and ligaments that hold the joint together weaken and stretch, and gradually the joint loses its shape and alignment, which again means that your joints are going to go directions they're not supposed to go. They're going to twist in ways that they're not supposed to do, and it's because of the inflammation and the damage that is caused by the RA. Doctors don't know what starts this process, although a genetic component appears likely. While your genes don't actually cause rheumatoid arthritis, they can make up more susceptible to the environmental factors such as infection with certain viruses and bacteria that may trigger the disease. My mom has arthritis, but she doesn't have rheumatoid arthritis, so I'm not exactly sure where the rheumatoid came from because not a whole lot of the family has rheumatoid arthritis. Lupus is in the family, so I guess it's probably from the lupus, but I'm not quite sure. And like I said, I'm not quite sure as to when I got the RA, like when it became active. I have no idea. Risk factors. Factors that may increase your risk of RA include sex. Women are more likely to develop rheumatoid arthritis, like with lupus and a lot of autoimmune diseases. Women are more susceptible to actually have it active. Men are usually more carriers of the disease, which means they have it in their blood and everything in their genetics, but they don't become active normally. Normally women are the ones that are active. Age. Rheumatoid arthritis can occur at any age, but is most commonly between the ages of 40 and 60. Again, if there's other reasons why you would get rheumatoid arthritis, that would be into where why you would get it earlier or later. And family history. If a member of your family has RA, you may have an increased risk of the disease. Like I said, I'm not totally sure of anyone in the family who had RA, so I don't know where it came from. Complications. And this is the fun part, guys, and this is the scary part for me. Rheumatoid arthritis increases your risks of developing osteoporosis. RA itself, along with some medications used for treating rheumatoid arthritis, can increase your risk of osteoporosis, a condition that weakens your bones and makes them more prone to fracture. Carpal tunnel syndrome. If rheumatoid arthritis affects your wrist, the inflammation can compress the nerve that serves most of your hands and fingers. Heart problems. Rheumatoid arthritis can increase your risk of hardened and blocked arteries, as well as inflammation of the sac that encloses your heart. Ooh, that scared me. Lung disease. People with rheumatoid arthritis have an increased risk of inflammation and scarring of the lung tissues, which can lead to progressive shortness of breath. Treatments and drugs. There is no cure for rheumatoid arthritis. Medications can reduce the inflammation in your joints and in order to relieve pain and prevent or slow joint damage. Occupational and physical therapy can teach you how to protect your joints. If your joints are severely damaged by the RA, surgery may be necessary. Medications. Many drugs used to treat RA have potentially serious side effects. Doctors typically prescribe the medications with the fewest side effects first. You may need stronger drugs or a combination of drugs if your disease progresses. Okay, so I'll be able to tell you what I've been on and where I'm at now with treatment-wise. NSAIDs, which non-steroidal anti-inflammatory drugs, can relieve pain and reduce inflammation over the counter. NSAIDs include ibuprofen, which would be Advil or Motrin IB, and naproxen sodium Aleve, which I am taking ibuprofen and Aleve at the moment because I don't have anything else for inflammation. Stronger NSAIDs are available by prescription. Side effects may include ringing in your ears, stomach irritation, heart problems, and liver and kidney damage. Steroids. Corticosteroid medications such as prednisone, which I have taken, reduce inflammation and pain and slow joint damage. Side effects may include thinning of the bones, weight gain, and diabetes. Doctors often prescribe a corticosteroid to relieve acute symptoms with the goal of gradually tapering off the medication. Disease-modifying anti-hemolytic drugs, DMARDs. These drugs can slow the progression of rheumatoid arthritis and save joints and other tissues from the permanent damage. Common DMARDs include methotrexate, which is Trexol, lefomide, which is Arava, hydroxychloroquine, which is Plequenol, and Plequenol is the one that they tried with me, and I was allergic to it. And so my next, after I go back to the doctor, because I'm going to a new doctor, they're probably going to try and see what they can give me for that. And sulfasalazine, which is azuladine, I can't pronounce that. Side effects may vary, but include liver damage, bone marrow suppression, and severe lung infections. Go lay down. Why are you bothering me? Go lay down. Sorry, guys. My dog is like hovering. Biologic agents, also known as biologic response modifiers. This is a newer class of DMARDs, including... I'm not going to read all these because they are really, really hard to pronounce. A new synthetic DMARD is also available in the U.S. These drugs can target parts of the immune system that trigger inflammation and causes joint and tissue damage. These types of drugs also increase the risk of infections. Biologic DMARDs are usually the most effective when paired with a non-biologic DMARDs, such as like methotrexate. Therapy. Your doctor may send you to a therapist who can teach you exercises to help keep your joints flexible. The therapist may also suggest new ways to do daily tasks, which will be easier on your joints. For example, if your fingers are sore, you may want to pick up an object using your forearms. Assistive devices can make it easier to avoid stressing your painful joints. For instance, a kitchen knife equipped with a saw handle helps protect your finger and wrist joints. Certain tools such as button hooks can make it easier to get dressed. Catalogs and medical supply stores are good places to look for ideas. Surgery. If medications fail to prevent or slow joint damage, you and your doctor may consider surgery to repair damaged joints. Surgery may help restore your ability to use your joint. It can also reduce pain and correct deformities. Rheumatoid arthritis surgery may involve one or more of the following procedures. Total joint replacement. During joint replacement surgery, your surgeon removes the damaged parts of your joint and inserts a prosthetic made of metal or plastic. Tendon repair. Inflammation and joint damage may cause tendons around your joint to loosen or rupture. Your surgeon may be able to repair the tendons around your joint. Joint fusion. Surgically fusing a joint may be recommended. Stabilize or realign a joint and for pain relief when your joint replacement isn't an option. Surgery carries a risk of bleeding and infection and pain. Discuss the benefits and risks with your doctor. Lifestyles and home remedies. You can take steps to care for your body if you have rheumatoid arthritis. These self-care measures, when used along with your rheumatoid arthritis medications, can help you manage your signs and symptoms. Exercise regularly. They're not talking like vigorous exercise. It's more like non-strenuous exercise, just light exercise. Apply heat or cold. So you could do heat compresses or cold compresses to help with pain or inflammation. And relax, which means which I have a hard time doing because I am a very active person, which means when you're feeling like you're so exhausted and drained from the disease, or you're just really, really sore, you should just take time. You should just take the time to relax and let your body try to adjust to the swelling and the pain that you're dealing with. So that's all the notes that I have on that. As far as my own experiences go, right now I'm having a major flare up. I do have an appointment to see the new rheumatologist. It's in April sometime. April 27th, so I will let you guys know when I go back to the doctor what they say. I really don't know what they're going to say because, like I said, I tried the Plequenol, and the Plequenol I was allergic to, and a lot of those drugs, they're pretty much the same thing. So I'm really kind of hoping that I'm not allergic to all of them because, yeah, that kind of sucks. So as of right now, I am taking a muscle relaxer. And I'm also taking either a Aleve during the day or ibuprofen PM to help me sleep with a muscle relaxer. But yeah, I already have some of the progression, which isn't good because it's progressing pretty fast. I'm having a lot of issues with it right now, and I'm kind of hoping like this flare-up just goes away and it doesn't just keep progressing, because if I have the progressive type of rheumatoid arthritis, most medicines probably won't work, and it's just going to keep getting worse. So, also I'm going to make a video on lupus, because I was asked to do a video on lupus to talk about, what it is, what you do for it, what to look for, because a lot of people don't know exactly what lupus is. It's still a disease that a lot of people don't know about. A lot of people don't really know what rheumatoid, like I said, a lot of people didn't know the extent of rheumatoid arthritis. Some people did, some people didn't. because there is different types of arthritis, and when people hear arthritis, they just think of stiffness in the joints, and that's not the case with rheumatoid arthritis, because it is an autoimmune disease. And also, if you guys would like, I can also do a video on fibromyalgia, because I also have fibromyalgia. So if you guys would like me to do a video on fibromyalgia, I can do that too. Like I said, I'm going to put pictures up throughout this video so you guys can see what I'm talking about when I say deformities or, you know, joint damage and stuff like that. There are three other conditions that I might have that they don't know for sure yet, so I haven't really gotten into those yet. So I think after my doctor's appointment, if I end up finding out that I do have those, I will make a video about them. But as of right now, I'm trying not to jinx myself, so I'm not going to address those situations right now. So, but if you guys would like me to make a video, like I said, I'm going to do one on lupus. If you guys would like me to make one on fibromyalgia, if you don't know what it is, I can do that too. And if you guys have any more questions about my health or anything that's going on, you can do that. I do still have my GoFundMe page. I did reactivate it, but you guys don't have to donate. It was just because a lot of people were still asking, like, how could they help, if any way or form, like, if they wanted to help, how could they help? So as of right now, I do have insurance now. How long that's going to last, I don't know. But as of right now, I do have insurance. It's Medicaid, so it's really hard to find doctors. Really hard to find doctors that specialize in what I need them to specialize in. So hopefully everything goes right with this situation with this doctor. I need to call my old doctor and see if they could get me the medical release form, because I'm having issues getting the medical release form to get my information over to them, to the new doctor. And then I think that's it. But as of right now, any of the money that I got from my GoFundMe was going to go towards my medical debt that I am in, because for a while there I didn't have insurance, and last year was terrible, and I am in some medical debt. So yeah, that's where that stands. Again, you guys don't have to donate. I'm not asking for money. I'm not asking for anything. It's just there if you guys want to. I think that's it. And I will talk to you lovelies later. And like I said, if you have any more video ideas for me to do, let me know. And yeah, I'm gonna go, and I will talk to you later.